everyone, I'm Dr. Tour from Amplify Eye Care, and today we're going to go over a disease called glaucoma. As many of you have probably heard, glaucoma is pretty common, more in the older age population. It's rare, but it can also be congenital. That means you can be born with glaucoma. But again, it affects mostly the older population. And typically glaucoma is something that's going to affect your peripheral vision out on the sides there. And usually early stages of it don't actually have that many symptoms, and you may not know that you have glaucoma early on if you're not getting regularly checked. In the severe to late disease, you can have something that's called tunnel vision, where your central vision is the only part that you see and your peripheral vision is completely missing, and that's pretty end stage severe glaucoma. So glaucoma, what it is that there can be several different types and different forms, but essentially all of them end up causing damage to your optic nerve. That's the nerve connecting your eye to your brain. So if those fibers and tissue get damaged, that starts affecting your vision. And so again, that damage can happen from several different ways, and usually the biggest kind of factor that we can control and we can treat is the pressure. So a lot of times the glaucoma nerve damage is associated with the pressure of your eye. So when we check pressure, it's kind of a screening that we do in your regular eye exam, but for glaucoma treatment, we usually use eye drops, and there are several different types that you use daily to lower that pressure and hopefully keep most of your nerve tissue that's there. So because of how kind of slow changing and how non-symptomatic glaucoma is, it's really important to be aware of if you have any family history to get regularly checked regardless, and especially if you're over the age of 40 or 50 to be screened regularly for glaucoma, because the goal is for us to catch it early and us to treat it so early that you do not actually pretty much notice that you have glaucoma, that we treat it and keep it in the way that that you don't have symptoms. Now, with those drops, there are more kind of invasive procedures as well that we can do if the drops aren't controlling the progression, and that includes kind of laser surgery and things like that. That's obviously options after the drops don't work, or say that you're on multiple drops, and that again is to preserve any vision, because glaucoma is tissue that has been lost. There is no bringing back that vision. We can just kind of try to keep whatever is left. And again, that's why it's so important to be screened regularly for it, especially if you have risk factors or family history for it, so that we can catch it early and treat it on. Thanks.